fibrous needs a little shove to get there, but you want somebody that knows what they're doing to actually do that. All right, we're going to be reminded that the capsule completely surrounds the fossa, creating a partial vacuum. So the capsule is coming in like right here. Okay, so it completely surrounds. So you've got the labrum sticking out, which is like a little rubbery cartilaginous lip, and the capsule is going from the head all the way around here. So remember when we were first talking about synovial joints, and we talked about that fibrous capsule. That's why it's important, is because it surrounds that glenoid fossa, so it creates a partial vacuum. So the pressure of that vacuum kind of creates a little suction to hold it together. Okay, so we've got ligaments, now we've got the capsule that's physically, fibrously holding it together, that creates suction to hold it together. Okay, then we've got the rotator cuff muscles. So remember we said they're going to be supraspinatus, infraspinatus, subscapularis, and teres minor. Okay, so 3 external rotators, 1 internal rotator. What they do is they actually surround this head of the humerus, or create a cuff to hold that together. And then we've got the other shoulder muscles. Okay, so it's a layered effect. And so we've already seen how complex this is. So if any one piece of that is going wrong, it can throw the whole rest of it off, because something else has to work harder to take up the slack. Okay. So here's, and this is actually from your book too. So if we're looking, this is anterior, because here's your coracoid process, acromion. So you can't really see it, but the coracohumeral ligament is like in here somewhere. Here's your like rotator cuff muscles coming in through here. You've got the capsule. Here's that long head of the bicep, so that tendon's coming up here and playing a role in that too. Okay. So that joint capsule can be defined further as a thin-walled, spacious container, attaches around the rim of the glenoid fossa in the anatomical neck of the humerus. And so it's like here, so not out here, but here to here. That's where here to here. This is like pretty much just the base of that roundness is your anatomical neck. Okay, you're probably not going to differentiate that by feeling.
And that's where the joint capsule is like right in there, okay.
It's like, here's your glenoid fossa, so it's all the way around this,
Okay.
and then all the way around just the top part of this bone. Here's your capsule.
Thank you.
Okay. So it's the outer part of it is the fibrous membrane, so it's pretty strong. The inner lining is that synovial membrane. So you remember what we do with synovial fluid? We lubricate the joint, right? So we lubricate those bones so we can get that roll, glide, and spin that we want without pain. So the joint capsule can be taut or tight or slack. So the arm hanging at your side, the superior part of that capsule is going to be tight. Okay? Because it's helping hold my arm, I'm pulling on it. Okay? So in that case, the inferior part is going to be slack. If I go the other way, the opposite is going to be true. This part is going to be tight because I've pulled it tight. This top part is going to be slack. So there's a little give and take in that. It's not just a tight ball. We've got to have give and take in that. It's kind of like if you've ever seen a car that's got a gear shift and you know you've got that rubber boot that goes over it. It's not tight. It's got to be loose enough to allow that gear shift to move around. That's what your joint capsule is kind of like. Does that help describe it for you?